Hi, I'm Dr. Erin Smith, facial plastic surgeon in Austin, Texas at Buckingham Center, and today I want to talk about a deep plane facelift. So what is a deep plane facelift? When people come into my office, they come for various concerns for their facial aging. So this could be that their cheeks are falling, they have jowling, they have heaviness around the mouth, they have crepey skin when they smile, or their neck is heavy and they have banding in the neck. All of these are indication for a deep plane lower facelift. So what separates a deep plane facelift from a regular facelift? In most facelifts, they are performed with a hidden incision around the ear, very hidden in the hairline. In the face, we have this nice gliding plane along the neck and jawline. So most average facelift surgeons can go in this plane and lift the jawline and the neckline and get an average result. And most patients will like it. But what separates the deep plane facelift is that you go a little bit higher and a little more anterior in the cheek. We have these structures in our cheek called facial retaining ligaments. And basically, they keep the cheek tethered down. If you do not go in the deep plane and go through these ligaments, the cheek is not going to move. So while you may get a nice improvement in the jawline and in the neckline, the cheek stays fixed or stays in place. And so that can sometimes look okay if you don't have much cheek descent. In most patients beyond age 40 to 45, the cheek is dropping too, creating a nasolabial fold. So it looks a lot more natural if you lift all three areas as a unit together, the midface, the jawline, and the lower face. And so this takes specialized training. Not everyone is trained to do the deep plane facelift. In the deep plane facelift, you are in a deeper layer and a little more anterior, and so you need to be very, very well versed in the anatomy of the face. I specifically trained in a practice where I got special training in the facial nerve. The facial nerve is a structure that is in this area that you want to keep nice and safe. So if you are going to pursue a deep plane facelift, you want to go to a surgeon who is double board certified in facial plastic surgery, as well as head and neck surgery, and who has high volume experience in this area, because in this area there can be some trickier structures that you want to keep safe. And so in our practice, we are all facial plastic surgeons, meaning we all three are double board certified in this specialty. And what this means is that we only operate on the face, which allows us in our practice to do upward of almost 1,000 facelifts a year.